Hello, my name is Dr. Meredith Warner of Warner Orthopedics and Wellness, and I'm pleased and honored to be a sponsor for this year's RocketChix Triathlon in Baton Rouge. I wanted to give you 3 tips and 3 common injuries that happen to runners. I have a special interest in running and a special interest in the treatment and care of the foot and ankle. There are 3 very common foot and ankle injuries that occur to runners. Number 1, Achilles tendonitis or tendinosis, which happens at the heel cord in the back of the foot. Number 2, plantar fasciitis, which is also heel pain, but on the bottom of the foot. And then number 3, stress fractures. Stress fractures most commonly happen on the second metatarsal, but they are sometimes known to happen in the heel as well. The 3 tips I want to give you for your running and triathlon event are as follows. I think for blister prevention, if you tape the toes and give yourself a good taping around the first toe joint, the big toe joint, you can prevent sesamoiditis, which is an irritation of the 2 small kneecap-like bones under the big toe, and you can prevent a lot of blisters, and it'll give you good push-off strength. The other thing that you really need to do as a runner, particularly a distance runner, is stretch your hamstrings. If your hamstrings are tight, you will get a lot of anterior knee pain between the patella and the femur. The third thing that you can do to prevent injuries is wear the proper shoes. I think that the best thing to do is seek a professional with adequate training in foot and ankle to assess your gait, assess your foot, and pick the right shoe for you. I wanted to introduce one of our partners, Levin's Physio. Levin's Physio has a strong functional movement screening program. This is a way for you to analyze your performance as an athlete in all 3 of the rigorous events of the triathlon, and to improve that performance and prevent and treat injuries.
Hi, I'm Steve Levins and I'm happy to be a part of the triathlon. We do a functional screening exam in which we analyze the motion and movements throughout the whole body to try and pinpoint where there's imbalances that may be affecting performance. For example, with a lot of swimmers that do a lot of yards in the pool and have a lot of overhead motions, start developing shoulder impingement problems. It may not just be at the shoulder. We sometimes find that it's more with the motion through their back or other parts of their body, and so doing these evaluations will help us to pinpoint things to improve your performance.
Once again, I want you guys to know I am so honored to be a sponsor of this year's RocketChix Triathlon. I'm a big believer in exercise and wellness, and hopefully you guys are fit enough that you never actually need to come see somebody like me. But should you get an injury or have pain, we're here for you.